Finally spring, at least that's what the calendar says, after we got through a tough cold winter with cold and flu season. What's waiting for us? Allergies, and it's going to be a particularly harsh time for allergy sufferers. At least a new report from the Asthma and Allergy Foundation of America released a list of cities with the worst spring allergies. Boston not on the list, so we have that going for us. Dr. Jessica Savage is an allergist with Brigham and Women's Hospital. She joins us live now this morning. And Dr. Savage, is there something about the previous winter that's an indicator for how bad the allergy season is going to be?
Well, you know, we don't always know. We can't always predict, but we think this has been a terrible winter. It's been so cold and going on for so long that we do think that the trees are sort of conserving their pollen. They're hedging their bets for when it starts to warm up a little bit. So there are two things that could really hurt the allergy sufferers. One is that the tree pollen season could go so late into the summer and actually overlap with the grass pollen season. So you'd have kind of a double whammy of trees
punch
and
there.
grasses. Yeah. And the other thing is just all the pollen could come out at once. You know, you recall when we can actually write our name in the car.
Yes.
So that could actually be really
anything else
things.
In your history here that is a problem for folks? You know, oak or any of the other.
Right, so spring
ragweed
is really a tree pollen season.
Okay.
So ragweed comes out, you know, everyone sort of puts the blame on ragweed, but that comes out later in the fall, and we can't really predict from the winter what's going to happen with the ragweed season yet.
Okay, so it's the tree stuff. Curious here too, because some people I know who have been relatively healthy and all of a sudden they develop allergies. Is it possible that you're in your 20s, you have no problems with allergies at all, but as you get older you start to develop them?
Absolutely. So we wish we knew why people get allergies, and we still don't fully understand that. Generally, the tendency to develop allergies starts young, but you may actually not develop those allergies until later in life because it takes that tendency plus being exposed to the allergen. And certainly plenty of people come in their 30s and 40s complaining of new allergies.
Mm-hmm. What are some of the most common symptoms people should be aware of? And what's the difference between those symptoms and maybe symptoms that can be confused as being related to allergies but might be related to something else?
Right, so the typical hay fever symptoms are itching in your nose, sneezing, stuffy nose, runny nose, this itching that you can get back in your ears. And people can actually confuse that with sort of non-allergic symptoms, which are sort of the drip, the congestion, but that might be due to irritants in the air like pollution, changes in barometric pressure.
Does it affect your overall level of energy as well? Can it
Absolutely.
knock you out? Yeah.
We have people come in and their primary complaint is just that they are tired and wiped out, and taking good care of their allergies can help them get back on their feet.
So what are the things people can do now? I mean, if it's coming and you know it's coming, there's only so much you can do. You can't avoid it unless you move, I suppose.
Right,
but
right.
What steps can you take in advance to try to lessen the blow?
Well, it is important to know what you're allergic to if these symptoms are due to allergies. And so an allergist can do the testing and tell you exactly which trees or
blood
grasses.
test, more or less? Or?
Usually it's done by skin testing now. And so once you know, hey, I'm allergic to maple tree, you figure out that maple comes out early in the spring, and you start your allergy medicine 2 weeks before the maple season. So we do recommend for most people a nose spray called a nasal steroid, and starting this about 2 weeks before the season can really help get you on your feet.
A little preemptive strike there.
Exactly.
And they got some new treatments as well that you're working on, which help folks out.
Yeah, so it's going to be still, unfortunately, a couple of years, but we are very excited that instead of doing allergy shots where patients come into the office and we try to desensitize them through giving them shots of the things that they're allergic to, we're actually developing some oral formulations, so you could actually take a tablet every day in the privacy of your own home, which I think would really help patients a lot more.
Make things a little bit easier.
Exactly.
Well, it's coming, folks. Prepare. Remember, get your stuff early to avoid really getting hammered by the allergies. Dr. Jessica Savage, appreciate you coming in this morning.
Thank you so much.
Thank you so much.